We're going to call this meeting back in session. And Dr. Gales and Dr. Stoddard, thank you for being with us. And whoever would like to lead off the discussion, please lead it off. This is under, as you know, under the council sitting as Board of Health. And just as an aside, I am going to go to a 5-minute rule for the council members so that we can be as efficient as we can be once we start asking questions. So Dr. Gales or Dr. Stoddard, please.
Okay. I'll give it a shot. I will say that I do have to step off at 11:30 for another call, so I will make my comments very concise to allow for questions and turn the floor over to Dr. Stoddard. I do want to make a couple of points. The last week there's been a lot going on in the COVID space. I think we all have followed the news and watched very carefully, and we continue to watch the evolution of different messaging coming from the federal level. It is extremely problematic from my perspective as a public health official and as a clinician in terms of the rhetoric that has been put forward recently related to COVID-19. There are a couple of things I want to highlight. This morning, I had the opportunity to do an interview, a radio interview with WMAL. Great conversation and discussion. But one of the things, the comments that was made, troubled me, is that as the health officer, this is paraphrasing it, I have a lot of power to influence and affect people's lives. I just want folks at home to understand that we are not doing this about power. It is not our job to influence people's lives. It's our job to put forward public health guidance to keep people safe. And we will continue to do that to provide to the council members, his Board of Health, and the county executive in terms of putting forward ideas and plans and policies to keep our residents safe. Another thing I want to emphasize is that there seems to be some confusion around isolation and quarantining. If you do test positive and you are given guidance to isolate yourself, it is the expectation and the legal requirement that you do so. And so we want folks at home to understand that if you test positive or if you have been identified as a contact and have been given guidance to quarantine, it is the expectation that you will do so based upon the period and the guidance that you have been provided by the disease control staff in the health department. Failure to do so goes against the Maryland Code of Health, and that can carry consequences in terms of being delivered quarantine or isolation orders or further legal action if you choose not to adhere to that guideline. So moving forward, we continue to see, when we look at our numbers this morning, we saw a case report of 53 cases. And this is a decrease from the last several days where we have seen a couple of days reported over 100. Our test positivity is holding at 2.6%. However, consistent with the state, our cases per 100,000 have increased slightly, and we currently sit at 8.9 cases per 100,000, our 7-day average. It's important to also note that when we look at these averages, we continue to get questions about when we're moving forward to phase 3. Our 3-day average in the last couple of days has been somewhere between 90 and 99 cases. When we moved to phase 2 back in June, we had 58 cases. That was our daily average. So to give you some perspective in terms of where we sit. We have made strides, continue to make strides in our testing capacity. We have brought on an addition, we finalized a contract to bring in an additional lab to, again, expand on our current capacity, which I'll be happy to talk offline about. Yesterday, as part of the county apparatus, we tested over 1,200 people. And that's inclusive of our different initiatives in place, as well as the different county sites that are available. We continue to work with our colleagues at the state around distribution of rapid testing mechanisms. And one of the challenges that has existed with rapid testing within community venues, and I want to speak to a question that Council Member Reamer brought up that over email and wanted to address, is that we have had some challenges with those clinics and venues doing rapid testing in terms of them reporting the results to the state. We have taken action on a local level in terms of working with those venues to ensure that they're being reported. And as rapid testing expands and is currently expanding, the state has worked with them as well and put out language in terms of how that information will be recorded and included into the COVID link system. So if you are hearing reports where that information is not being reported to the state, please let us know, as that is a requirement and expectation that those venues will do so. Now, the last thing I want to talk about before switching over to Dr. Stoddard is we continue to investigate cases in our non-public schools and our school system, as well as we have had a couple of instances over the weekend, one in particular involving youth sports and athletics, particularly soccer. We do have an outbreak that we are investigating related to a club soccer team, as well as a school-related soccer team. We have over 4 cases identified so far, and from my understanding, there's at least probably 30 individuals who have been quarantined as a secondary effect of those potential exposures. So we continue to investigate and provide guidance in those instances. We will have another session with our non-public schools on Friday to talk through supporting them in their reopening efforts, and we applaud them in the efforts that they put forward so far. We also continue to work with our colleagues at MCPS in terms of providing guidance for them on a host of issues, school reopening, sports, and athletics as well. And we thank all of them for their continued efforts to try to do best by their students in terms of keeping them safe and increasing instructional opportunities and increasing access to those types of things. I will stop there and pivot to Dr. Stoddard, and happy to answer any questions that you all may have. Thank you.
Dr. Stoddard, please, and then we'll get to questions.
Morning. I have a few updates I want to provide. Dr. Yale said we're continuing with our non-public school meetings. We had a meeting last Friday. We'll have another meeting this Friday as well, continuing to provide them support, and we've gotten some excellent feedback from the non-public schools about our continued efforts to provide them answers to questions and provide them areas where we don't have certainty. I think the fact that we've been candid has been very well received by them. Second, we continue to meet with partners to look at opportunities to do some different things. Most notably, we did do a in-person walkthrough at the Soccerplex to consider with them how they could potentially do some tournaments, up to and including some out-of-state tournaments, whereby they'd actually do as some of the professional sports leagues have done, and attach testing protocols to the attendance to the tournaments and things like that. And so we do have some positive movement there, and we're looking for some accommodations there. We had a meeting yesterday to talk with some of the hockey providers to talk about modified hockey, which is if you have not seen, modified hockey was added to the state's list of medium risk sports. And assuming we can get hockey providers that can meet those standards of modified hockey, which reduces some of the contact points, we are looking for opportunities to consider those. We already met with the escape room operators as well, and are looking for ways to address that, assuming we can get the cleaning requirements. As you can imagine, that would be a challenging thing in the skate room. And then we're also meeting with the theaters, both the live performance theaters and the movie theaters this week as well, to talk through what options are there. I'm sure most people are familiar with the news regarding the Regal Cinemas decision to not have their theaters open across the country. To be clear, I think, that is in part because of some of the orders that have been placed locally across the country, but also people are just generally not going to movie theaters. And so we have to recognize that regardless of whether they're open or not, they're not being well attended across the country. And movies aren't being released because the movie companies are not doing so. So just in advance of people hearing about that more, those are things to consider. On the enforcement front, I do want to talk about the late night alcohol permit. We had, as of yesterday afternoon, 153 businesses who have requested and received those permits. As of yesterday, we had not received a complaint related to those late night activities. However, we did have a team go out, and we focused, particularly because we haven't had as many complaints in the Bethesda and North Bethesda areas. We wanted to make sure we're still, just because we're not receiving complaints doesn't mean things aren't happening. We went into those locations, and I'm pleased to report that despite our visits, we found nothing that warranted issuing of a citation or a closure, and only one warning was issued over the weekend with some targeted enforcement in the Bethesda and North Bethesda areas. We'll continue to disperse our teams throughout the county to hit all the areas in an equitable fashion. We're actually going to meet with Chief Equity Officer Ward to talk about our enforcement mechanisms to make sure that we're doing those equitably across the county, and she can help us with some of those, methodologies. We have a handful of businesses who have applied for the permit, but they have previous citations or closures associated with those businesses. And so we will be working on an administrative appeal process for those businesses who would normally, by the executive order, not be permitted to receive the late night alcohol sales permit, but we will be making an individual assessment appeals process for those businesses. We have already decided to, there was a lot of ambiguity around the live performance issue. So those businesses that had a live performance violation, we did sort of set those to the side and let them apply for and receive. But where we've seen challenges there are a number of businesses who had physical distancing, face covering, or hookah repeated violations typically. And so we're going to review their applications on a case-by-case basis and look for a consensus between Alcohol Beverage Services who issuing the permit and Health and Human Services, who obviously is looking out for the public health interest. We've talked a lot about the Halloween guidance already. I do want to clarify a point though that has come out in the media. Montgomery County is not banning Halloween. This has been a sort of a common catch point. We were asked for guidance. I mean, number one, Halloween is not an activity that government regulates, sponsors, or operates in most cases. We were asked for guidelines on what people should or shouldn't do. We provided some recommendations, and we are providing avenues that people can do certain activities that we believe are more safe and achievable. What people do with those recommendations are up to their individual personal choices. We are not going to have people out issuing citations or making arrests on Halloween night for decisions that are made. We were asked for a set of recommendations, we provided those, and we want people to understand that. The last piece I will touch on is the USDA food boxes. This has been an area of increased concern and interest. And as a reminder for those who aren't aware of this, the county had been receiving approximately 26,000 food boxes from USDA a week. Last week, that number was reduced to 4,000, obviously creating a delta of 22,000 boxes, all of which were being used in the county on a weekly basis. If the county were to replicate purchasing those 22,000 boxes ourselves, that's roughly $750,000 a week worth of supplies, which is obviously not sustainable over a long period of time for the county. So we've done a combination of methods to try and address that gap. First off, we are purchasing bulk produce and we are delivering it to the food access providers for them to break down and box up themselves. Number two, we are providing credits to the food access providers to shop at local distributors for produce as well. We're connecting providers to other producers of source foods so that they can actually acquire them through their normal mechanisms and grant processes themselves. We're working on an agreement with Capillary Food Bank and Manna to provide credits for accounts for additional procurement of supplies and produce. And then we're rotating the 4,000 boxes that we're getting to different providers each week so that we can try and distribute the nutritional foods across as many places as we can. I will note that the 4,000 boxes, and this is just out of a deference to what USDA is doing, those boxes are actually improving in quality. And so they are now including both dairy and meat products as well. And so we very much appreciate the boxes we get from USDA. We just wish we were getting somewhere closer to what we had been getting for a long period of time. We continue to work on our hubs build out. East County is up and operating. We're at Black Rock, Gaithersburg Cares, the Hughes United Methodist Church hub. We're also doing pop-up locations where we're doing food provision and other service coordination. The last piece I will touch on is the Food Access Call Center continues to get referral. Last week, we got about 64 referrals between the Food Access Call Center and the Gilchrist Center. 32 of those were in Spanish. So obviously about 50% are Spanish call diggers. And year to date, we've just now crossed the 3,000 person mark with the Food Access Call Centers, which is, it's great work, but obviously it's telling about how challenging these issues are. Each one of these calls is 45 minutes plus. and there's just a lot of need in our community. We're working to integrate additional services. We've done eviction prevention, SNAP eligibility. We're looking to work in through that process as well, and so it's becoming a much more collaborative and comprehensive call taking process. So I will stop there.
Thank you very much. And I did want to make a thought, first off, to thank Senator Cheryl Kagan, who's certainly been in contact with me and many others. I know she's been in contact with you as well, specifically about the Up-County Gaithersburg area for testing, Germantown and beyond. I know that you're there as well. And we also need to continue to look at the Rockville area, especially Twin Brook and other areas. In the city of Rockville, I've been in contact with them, and they're certainly want to let you use facilities that the city has and to work with them on various areas. And I understand you're looking at areas in the Potomac area as well for continuing testing, so additional testing. So I do thank you, but there again, I know that testing is something that we need to continue to do, and the more convenient it is for people, the more they will do it. And with that, I'm going to go to the 5-minute rule now, and I spoke less than 5 minutes. I think that should be noted. Councilmember Albernaz is the first speaker.
Thank you, Mr. President. Let me acknowledge up front, this will be more comment than question, but I want to follow up on Dr. Gales's initial comments in his report out and just talk about how deeply troubling and shocking the last 4 days have been in our country, thanks to this president. Local jurisdictions have had to overcome the incompetence and lack of leadership to establish testing, to establish our own roadmap, to secure PPE, and effectively be on our own. Thanks to the efforts of Dr. Gales, Dr. Stoddard, and an army of public health officials and frontline medical personnel and emergency responders and service workers, Montgomery County has been able to overcome a lot. And our numbers today are thanks to those heroic efforts, including the efforts of our residents and citizens who have not listened to the White House, who have listened to the silence, to have listened to Dr. Gales and the army of public health officials, including Dr. Fauci, who have provided the correct information for us to follow. But what we have seen over the last 4 days goes into a new phase. The diminishment of this virus is just such a naked and raw attempt to try and retain power, to minimize this, to potentially impact an election. And the rhetoric, especially last night, and those images of the president walking into the White House, I got no sleep last night because it is just absolutely terrifying that the messaging coming from the person who's supposed to be our leader is so wrong and so incorrect. And now local jurisdictions, once again, are going to have to spend time and energy and resources to overcome that messaging. I remind all of our residents that it's not just the mortality rate of this virus that is terrible and shocking, but because of how quickly it spreads, what we experienced in April and May, when such a large percentage of our population overwhelmed our health providers and emergency rooms, it has a cascading effect on public health, not just specifically related to the COVID, but any other issues that may arise in public health in communities. And so we absolutely have to continue to be vigilant and adhere to the guidelines that Dr. Gales has been advocating for and making sure that we follow from the very beginning. We cannot stop. And now we have to work even harder to address the misinformation that we are receiving at the highest levels of government. I read a story in Politico last week that in September, there was a concerted effort to conceal information on the impact on children and youth of the virus by this administration. There is no bottom. There is no bottom. They are willing to put everyone at risk, everyone, including our children, in order to push forward an absurd message that is dangerous and that will impact negatively. It will negatively impact all of us. So we must remain vigilant through all of this, and I'm confident that we will overcome this messaging. But I did have one question as we wrap up. The White House is not participating in contact tracing right now. And if they were a business in Montgomery County, if the White House were a business in Montgomery County, they would be admonished. And I remind everyone that many of these employees live in Montgomery County. And I'll just say this also. What the president is doing is a slap in the face of all of the frontline medical personnel, including the people at Walter Reed that treated him, again, many of which reside here in Montgomery County. And so I'm going to try to calm down a little bit, but Dr. Gales, if you could talk a little bit about the importance of contact tracing and what it should look like when a business such as the White House has the kind of outbreak that we are seeing right now, and what should be done if something occurs within a school or a business here in Montgomery County.
Sure. Thank you for your comments. And I echo the sentiment. I think the most important tenet of contact tracing is transparency. And so any business or entity who has cases owes it to their staff to be transparent about the potential exposure and risk of exposure that they carry, because it's important for them to be able to seek the necessary health follow-up that they need in order to be safe. The contact tracing process, so for any individual who is a resident of Montgomery County, if we are notified that they test positive, we would conduct a contact tracing exercise and investigation within which we would engage potentially their employer, dependent upon their level of exposure and others who may be exposed. And we would provide the necessary guidance in terms of them being isolated, as well as identifying any other potential contacts who are at risk of exposure by definition, and would encourage them to get tested, but also require them to quarantine. I want to emphasize one point here as well. If you have been given isolation directions or quarantine directions, having a negative test does not exempt you from completing that time period. So if you have tested positive and you have been asked to isolate for 14 days, if you are feeling better, that does not mean you go back to work. If you have been told to quarantine and you get a negative test, that does not mean you are exempt from completing that quarantine process, because as we know, that quarantine process is put into place for a period of time because you could test positive anywhere during that window. And so we just want to make sure that folks at home, again, understand that even though you may be seeing this play out differently on TV, these are the real expectations for those of us on the ground if you were to test positive or be identified as a high-risk contact, and the expectations that would come with that.
Thank you. Councilmember Jawando.
Thank you, Mr. President, and thank you to my friend and chairman of the Health and Human Services Committee, Gabe Albornoz, for saying what many of us are feeling. Just how horrible of a point in our history that we're in, where we have to watch these photo ops that are literally causing harm. I didn't get that much sleep last night either, and I wasn't going to say anything about this, but I'm going to spend at least a minute or two because you got me fired up now. I know butlers and professional staff who have reached out that work in the White House right now, who, as you said, many of whom live in Montgomery County or in this region, who are scared for their lives because of the irresponsibility of this president. And coming off that airplane and taking, not putting on a mask, but taking it off, fist bumping somebody, doing a video to show and say, I had to get the disease because I'm a leader and I did it on purpose. Just everything he's done in the last 4 days has been totally contrary to all the medical science. And you're talking about outbreaks, Dr. Gers. We have an outbreak in the White House, in the seat of government for our country. We have an outbreak. And to those staffers and professional staff in the communities they live in, people are scared, and rightfully so, because of the disregard for public health guidance. And it sends a horrible message to the world and to all of us who are trying to do the right thing. And so I just want to commend you and Dr. Stoddard and this council and this government for holding fast to proceeding with caution and emphasizing the right medical practices. It's just an abhorrent thing to see. And I just hope our residents just listen to your local government in this case, because the federal government has failed us in this regard, at least at the highest levels. Thank God there are people like Dr. Fauci and others who are trying to sound the alarm and say the right things. But we have to stay the course here, because, as was said, these last 28 days, I don't think we've reached the bottom of the barrel, as Mr. Albanaz said, and more is going to happen. We must protect ourselves. I did want to ask a question, and just thank you again, Mr. Albanaz, for saying that. The positivity rates, Dr. Gales, that you mentioned, and the interplay between that and the 3-day average of cases, which you said I think is up to 80 in the 80s, where we had a couple of days in the 80s. Could you just expand a little bit on what you're looking for? You did this a little bit with saying when we move to phase 2, but what markers you're looking for now to move forward? Because I think we still get this form of function of this question. Okay, well, what exactly needs to happen before we move forward? Again, not pushing you. No one on this council is. I just think people need to be clear about it, and so they know what they can track themselves.
Sure, and we don't mind continuing to talk about it and discuss it, and hopefully make it clearer to folks. So what we're looking to see is, continued decreases or lower test positivity rates. Our test positivity has held below 3 for the most part. We did have a couple days over the last couple of weeks where it did uptick a little bit over 3%. So that's certainly one measure. But then the other measure is looking at the number of new cases, and then not just looking at the number of new cases, but looking at it based upon our population rate, so cases per 100,000. And so what we're looking to see is certainly evidence that we are seeing at minimum a moderate level of transmission within our community. Right now, today's is 8.9 per 100,000. As a point of reference, when we looked at the CDC guidelines for reopening schools, we qualify for the moderate to moderately high risk of transmission based on that number, just for that category, while our test positivity actually qualifies for very low risk or lower risk of transmission. So we're looking at those two factors in addition to, looking at making sure that our hospital utilization has not increased significantly.
And that's because we want good.
That's held stable. No, that's actually been really good. And our ICU utilization. So all of those measures have held and have performed well. But the challenge is when we still see moderate to higher levels of community transmission, that gives us pause, because that could be, if there's a quick shift in terms of, for example, in the conversation, again, it was a great interview this morning with WMAL. The conversation, we talked about the percentage of young people impacted. So we know that young people are more likely to have a less severe course of illness based upon what we've seen, but we also know that they are effective transmitters and carriers of the virus. And if they're coming into contact with older relatives or relatives who are vulnerable to more severe outcomes because of their pre-existing conditions, that could turn the tide in a different way and cause an uptick in cases, as well as an uptick in terms of more severe illness, which could impact our hospital systems.
Thank you.
Can I just really quick for summarization purposes?
You're not under the 5-minute rule, Earl. Go ahead.
You can answer my question as long as you'd like. Yeah,
okay. So I believe we went to phase 2 in June 18th. We were averaging approximately 68 cases over a 3-day span. We're 68 cases.
Actually, 58, so even better.
As of today, our 3-day average is approximately 90 cases a day. So I think, when we're talking about improvement, we want to be in a better situation to go into phase 3 than we were to go into phase 2. I think that's a really simplistic way to look at it. Case rate right now is our biggest holdup in moving forward in phases. I think just so we're incredibly clear, all our other metrics are looking much, much better across the board. Our case rate is still higher than it was when we went to phase 2, and that we're comfortable moving forward with for phase 3.
That's helpful. Thank you. Thank you, Mr. President.
Councilmember Navarro.
Thank you so much. I really appreciate Councilmember Albornoz's comments. There's no doubt that we are all just very, very worried about the developments of the last 48, 72 hours. I don't even know. Particularly this notion that people should not be afraid of COVID-19 while we have 210,000 deaths in the United States, and I believe something like 2 million worldwide. It makes our job a lot harder. I mean, it's already been difficult to do what we're doing because there has not been a guidebook, a manual. There has not been, clear direction from the national agencies, et cetera. But now we have to go back into our communities and make sure that people are not even more confused. So this is a very difficult time. I wanted to bring it back to a couple of things. First, really appreciate the efforts being made to meet with theaters and other arts and entertainment venues. I really appreciate your response to that. Yesterday, we had a committee session with our school system. One of the things that I'm very proud of has been how we've come together to embrace this notion, this concept of hubs as service delivery models around the county. I think that it's a great way to centralize, in different communities, a lot of the service delivery, and they're obviously standing up particular hubs for vulnerable, students, so they can also receive supports. But we know that these are they're the same families, right? So the hubs that we as county government have stood up obviously serve a lot of the same vulnerable families that are now serving those students in MCPS. And we did have a great conversation about, how can we best leverage all of these resources? I suggested that, school system meet with HHS and, with REC, with the appropriate departments to see how we can somehow connect the two efforts in order to leverage the very limited resources that we have. So I just wanted to, just kind of share that with you and, maybe just hear your initial thoughts on something like this. They're concerned about what's going to happen once they start at some point, opening up in a hybrid model, because some of the facilities that are being used for the educational hubs would not necessarily be available. And so, looking at how do we address the use of public use of community use of public facilities and prioritize that. So just want to hear your initial thoughts. Obviously, there's going to be, efforts to get together and think about this in a more robust way, maybe come up with a plan. But I think that this concept has been very, very productive in terms of the impact in the communities. So if you guys have any reaction to, perhaps how we can begin to merge some of this and also prioritizing the use of our public facilities.
Yeah, I would. So on the public facility side, I know we have already offered to them that we're more than happy to use non-school based buildings for them to do activities in. I've connected them with, we have a DGS lead who's actually helping to coordinate the diversity of activities happening in our facilities, from elections to food distribution facilities, all those things, testing. And so we've got a central point who's tracking all those activities so that we're not overly burdening one particular facility versus another. Now I've already connected them with MCPS so that they can coordinate on available facilities, whether it be for the hubs themselves, SAT testing, whatever it is. We want to make sure that, we're not opening our libraries generally to the public right now. And so those are excellent spaces they can utilize, rec centers, et cetera. And so we're more than happy to provide those and have offered that up already. I think it's an excellent idea and push, and I've already put it down to follow up with our teams on the community hubs and the school hubs. You're right; they're absolutely serving the same families, and so having those be coordinated and offering consistent and overlapping services makes a whole lot of sense to me. And making sure that we're sharing information across, which is already happening, so we can distribute through the hubs that we're operating, if they're not in all cases the same as the school hubs, because again, there will be facility challenges that make some of those overlaps challenging from the school food distribution perspective and others. So We will absolutely work together. They've been working on the food security task force with us for since the beginning, and so we're already overlapping a lot of services. But I think the idea of the school-based hubs is a great way for us to coordinate more.
Thank you.
Thank you so much.
Thank you. Councilmember Friedson.
Thank you, Council President, and thanks for all the comments that have been made in the update. I just want to say I live down the street from Walter Reed, where all of this is happening. It's often on my walk that I take pretty much every day, and I am scared of COVID-19. I just want to be very clear, and I think we all should be, and anybody who isn't concerned about a deadly disease and global pandemic, I would question their judgment. I do want to say I agree with everything that Councilmember Albornoz said, but I also think it's important. I don't want to lose sight of the fact that when the president gets sick, regardless of who is the president, they come to Montgomery County for care. And they come to Montgomery County to get the best treatment with the best doctors and the best medical professionals in the world. And I don't want to lose sight of that. I think we've all been very disturbed by some of the activities that took place, the rhetoric, the doctoring of photos and videos, the just absurdity of some of the commentary that has been used and some of the perverse actions that have been taken. But Montgomery County is the place where the President of the United States comes for care. And I think all of us as Montgomery County residents should be proud of that and thankful for that we live in a place that has world-class treatment, world-class talent, and is a place where the best care is available. And it's something that I don't think that we should take lightly. So I just want to make sure that I noted that. And I take it very seriously that it's something in my own backyard and in the district that I have such a privilege and humbling opportunity to represent. A few items unrelated to that, just wanted to follow up on largely with Dr. Stoddard. First of all, I appreciate you sharing the guidance on Halloween. I appreciate the clarification that these are not, an opportunity for the county to cite anybody. These are health guidelines to try to keep people safe, to try to provide some guidance so families understand what are the best activities in order to address what we know is going to happen or there's an interest in happening, and want to make sure we keep people safe. Appreciate the update on ice hockey and the change. I want to ask a related question. We've been asking or being asked some questions about flag football and some questions of some flag football happening, other organizations not being aware of whether or not they're able to do that. I think there's some discrepancies of what the state guidelines are and whether we're following the state on that. So I just wanted to ask, is organized flag football something that is currently allowed and under what circumstances?
So off the top of my head, I actually don't know the answer to this question. We are following, generally speaking, the state return to play guidelines. And so I'm going to try and pull those up quickly, but obviously I don't want to take from your time. So while I'm pulling them up, if there's something else you want to address, then I can maybe come back to it right after.
Yeah, no, that's the main one. And you can follow up after this. I just think there was some confusion that folks had. And I know that you had mentioned previously that the goal and the plan is to follow the state return to play guidelines. And I think there was some confusion there that some folks have. And so I just wanted to provide some clarity when folks reach out to us and ask if you could follow that.
I will do. Yep.
And then, sorry, go ahead.
No, there is a listing of sports, and I believe flag football is listed in one of the categories. And so I will be pulling directly from there and making that determination. Great.
And then I just wanted to note and thank you. I think the after 10 p.m. Guidelines have been implemented very well. I think that's been handled very well. I'm really encouraged to hear that there have been virtually no problems and issues, and that's just a credit to your team and to the businesses working collaboratively to keep people safe and figure out a way to move forward. I think it's a model for some other opportunity there. And the last one you had mentioned previously an interest on some of the arts institutions and looking at the indoor with strict guidelines, and just wanted to know if there was any update on looking into those efforts 50 and under indoor performances.
Yeah, so we are meeting with the live performances organizations. I believe Only Theater being among them this week. I don't have the exact date, but I think it was being worked out after the hospitality meeting last week. We also are talking to one of the things the county executive said, I know you were there for this, was we're really going to be following this DC pilot very, very closely. And so the DC pilot runs this month, essentially. It runs through the end of October. And so we're in weekly conversations with DC, getting updates from them on how their pilot's going. And assuming their pilot goes very well, I think we would very much be interested in adopting rules very comparable to what DC has done for its indoor performances. But rather than run two separate pilots at the same time, we've been being more deferential to what's being learned in DC and then applying that in Montgomery County should those results bear out. I know that some of the theaters wanted answers by October 15th. We're going to get an update again on from DC next week, and we'll make a determination about exactly when we're okay moving forward with DC's guidelines based on their pilot after we have that conversation.
Thank you.
Councilmember Rice.
Well, thank you very much, Dr. Gales and Dr. Stoddard. And, my colleague, Councilmember Albornoz, started off at the beginning admonishing the messages that are coming from the top leadership in this country. And it really is a disservice to people who've lost family members due to COVID in terms of the complete disrespect and what it means for those families who have struggled and unfortunately lost their loved ones, who didn't have access to 24-hour round the clock care that's the best in the nation, and also didn't have access to experimental drugs and all kinds of other things that are out there to help to make somebody look as though they're much better off than another. And, the messaging that's sent is very concerning to our communities of color because it makes it seem as though we've all been overblowing this and it's not really a big deal. And we know that who at the end of the day suffers, it's our people of color in our community, our folks who are of lower income and who don't have access to high quality healthcare. We know that they're the ones whose lives will be lost due to this charade of making it seem as though this virus isn't serious. And so I really appreciate the comments of Councilmember Albornoz. I appreciate your response, Dr. Gales and Dr. Stoddard, and I hope that people understand just how serious this is. That being said, my concern still remains about trying to reopen schools and what that means for us if we're going backwards. If we're going in a direction in which this president and this administration continues to make it seem as though it is completely safe and it's not a big deal, if the leader of our free world continues to not wear a mask as he enters into a closed building where other people are, what kind of messaging does that send? And does that make it harder for us as a locality when it comes to people adhering to rules, adhering to policies that are in place that will allow us to get back to safely opening our schools? So Dr. Gales, Dr. Stoddard, I'd love to hear your thoughts on this and what our public health officials, as well as our folks in the emergency management space are saying when it comes to some of this messaging.
Well, from the health perspective, we continue to support the guidance in terms of requiring face coverings, physical distancing, minimizing social gatherings, minimizing the folks you come into contact with unnecessarily outside of your network, because they are evidence-based practices that have been shown to mitigate and minimize transmission. We will continue to encourage and enforce those rules and requirements and guidelines, whether we're talking about restaurants, schools, or whatever entity we're focused on. We will continue to also use our contact tracing data to guide and determine if we need to make any tweaks to the provisions that have been reopened to date, or if we need to make any changes to that. And what you're describing, Councilmember Rice, is not just indicative of the last 48 to 72 hours. It's just this recent conversation around how we are couching and framing public health guidance as an enemy of happiness, health, and productivity and economic growth. It's not an either or conversation, but it's important to make sure that when we have those conversations, we also talk about the health implications behind it. We've seen recent, I think in the state of Michigan, there was a ruling to overturn the governor's health guidance that was put into place. And there have been similar court cases in Pennsylvania and other places where public health is being couched as an enemy of those things. That's not the case. We would love to see things open up. We'd love to have kids back in school. We would love to be able to have expanded hours and capacity in restaurants and facilities, but we also have a requirement to do those things safely, because we know that if we don't, and if we don't adhere to the guidelines, we set ourselves up for an increase in cases in the short term, as well as a long-term sustained increase in cases that would potentially require us to walk back the provisions that we have open now. And the last thing I'll say is that I know a lot of folks focus on the things that we can't do. We have a lot of things open right now. We can do a lot of things in society. You can go to a restaurant, you can go to your gym. There are even provisions in place for schools to reopen in some capacity. So there's a lot of things that are allowable right now that we continue to monitor and give guidance to do safely. We just want to make sure that at a minimum, we can continue those things without seeing a significant increase in cases that would require us to close those types of things down.
I'll just
Thank you very
summarize
much.
that. I'll just summarize that by saying there is no vibrant economy in an unmitigated pandemic. If we solve the pandemic, our economy is back in place, our schools are back in session, all those things. If we had done the things that we need to do back in May and June across this country, we are in a very different situation today. Mm-hmm. So we decided we wanted to have our cake and eat it too, and now we're continuing to suffer nationwide. That was a national decision that was made. We chose to go different pathways in Montgomery County, and we're better for it, but we're not as good as we would have been had everyone across the country done the same thing.
Dr. Stoddard, thank you for saying that. And Mr. President, just very quickly, because that is incredibly important. And I hope that people understand moving forward, we've got to still do that to counteract what we will see happening as a region. So we've got to remain vigilant. So thank you for that.
Thank you very much. Councilmember Reamer.
Thank you. Thanks to our HHS chair, Councilmember Albornoz, for being our voice and the voice of this county about the utter insanity that we have seen over the last few days. And, it's particularly galling that the President of the United States has guaranteed health care and is seeking to take that away from Americans. And this guaranteed health care that he has, he paid not more than $750 in taxes for, despite making nearly $500 million from the Apprentice television show. The man is insane. He's a maniac, and he's killing people day by day with his utter intransigence in the face of this virus. I want to talk a bit about the schools issue again. It is the comment that Dr. Stoddard just made that if this country had gotten its act together last spring and gotten the virus under control, we'd be in a different place now, is tragically true. And to Dr. Gales' comment about, there's lots that's open. I went out this weekend, I went and got a pair of shoes. We went and got some pickup meals. There's a lot of people out. You go to downtown Silver Spring, it's vibrant, it's popping. Like there's people everywhere. And I'm not saying that's wrong. I'm just saying that's the reality right now. And so if we're wondering why the virus isn't lower than it is, I think it's because we are, as a community, very active now. We are living our lives very fully with masks. Yes, we are paying many difficult prices in our daily lives, but we are at the same time, in many ways, experiencing a fuller life than we were. But there is a huge problem, and one of the big problems is the schools are not open. And we know that children are going to be paying the price of that every day, more and more and more. Dr. Gales, in your comments about the CDC guidance, you noted that, the case rate were too high. The test positivity rate, we are low. The third main thing that they identify is the school system's ability to implement a plan that mitigates the virus. As I said yesterday, when I joined the excellent meeting that Chair Rice convened, the Education Committee, the ability to implement a plan is That's a variable, right? It could be really high, it could be really low. Can you talk about how you weigh those three criteria together? I've been confused about the test positivity versus case rate. I think we just lean to the case rate being more important. We don't know what to make about the test positivity rate. But could you comment on those three variables, how they fit together, and to what extent do you think a highly successful mitigation plan implemented by MCPS could allow opening in different levels, different contexts, and so forth?
Sure, that's an excellent question. And it goes back to the earlier conversation about distilling the metrics so folks at home get a clear understanding of where we're moving. So I think to start off with, and consistent with our previous conversations on this topic, the real most important variable that influences the ability for a mitigation plan to be successful is when you have demonstrated lower level of community transmission. Because again, when you see lower community transmission, you are decreasing the likelihood that a student, a staff member, teacher, whomever walks into that school setting being COVID positive before you even talk about the mitigation plan, because we don't live in bubbles. We go home and we come into, as you mentioned, we go shopping, we go to the grocery store, we go to gym, we do all these other things that could potentially expose us that are not contingent upon what the mitigation plan is at the school. Now, mitigation plans are important. They are critical, but the first step is making sure that we have that lower level of community transmission to, again, decrease the likelihood someone walks into that space. So the two best proxies we have of that are our cases per 100,000 and our test positivity. So now there are some pluses and minuses with each one, but they both are important measures to give us a sense of, one, what is the impact and burden of the virus on our community, as well as are we testing enough people and catching particularly those individuals who are asymptomatic in that pool to identify those cases quickly, get them isolated, and remove them from networks of transmission, from unknowingly transmitting it to other people. So those two variables, again, with the mitigation plans in place, yes, we do need those, but the big factor is the community transmission levels, and why we've really encouraged to drop that number down even further so that we the mitigation plans can be effective, because folks are less likely to walk into the building with it.
I'm just going to add two comments. The case rate is not more important than positivity rate. They're equally important. I think those are the two biggest factors. It's just that our positivity rate, and this is something the governor touts on a regular basis, is within a very reasonable level for us to move forward with things. We just choose not to ignore the fact that our case rate is higher than we are comfortable with, and higher than, frankly, the CDC guidance and others say it should be to do a lot of things. And so it's equal measures of those two things. And as you know, the school plans, even back when we talked about before the year started, the MCPS planning was extensive and impressive. And so I think Dr. Yales and I both agree that having kids back in school, particularly vulnerable students, focusing our efforts and building out from there makes a whole lot of sense. And we're supporting MCPS in their planning efforts to do just that. But obviously we want to make sure that we're doing it in a manner that's consistent with the best interest, not just of students, but of faculty and staff as well, and make sure that they are accommodated in this process as well. And I know MCPS is doing that. And so I think what you're going to see is over the coming weeks, and I don't want to, this is Board of Education, they get to decide this. What I expect to see based on our conversations with MCPS is some opportunities begin to be announced in the November timeframe that gets some students back and starts us with the learning process that every school system in the state and country will face when they open up. You start out small and you expand from there. You start out with your special education, your ESOL, and your other students who have the most challenges, and you expand from there to your young learners who are new to a grade level, or our sixth graders who are new to middle school, our freshmen who are new to high school, those transitional periods. And then you expand out from there as you get more comfortable with the methodology. And so I think that's what you're very likely to see. That's what Dr. Yales and I have been supportive of. Now, obviously, that's in the context of what we're seeing today. I think we're incredibly concerned about what happens in a month with the overall. We may be on the rise again nationally, and then it throws even our best laid plans aside. But I think that's where we'd like to see this go over the next month to 6 weeks.
Thank you very much. Council Vice President Hooker.
Thank you, Mr. President. A lot has been said, but I don't want to belabor things, but I do want to thank Councilmember Albornoz and really all my colleagues for all your comments on the reckless comments and actions by the president this weekend and last night in particular. I know there will be people on Twitter and elsewhere saying that it doesn't really have anything to do with us. This not only puts our residents at risk all over the region, but it taxes our resources as we had to respond to the demonstrations outside Walter Reed. Doctors Gales and Stoddard, this is a very helpful briefing as always. Thank you for everything you're doing. I'm really glad to hear, and I echo what Councilmember Friedson said about that the late night alcohol service seems to have been rolled out really, I think, clearly and responsibly, and reflects what I and others had pushed for about coming up with a creative way to allow restaurant owners who want to take on more responsibility to keep their businesses going without punishing everyone for the reckless actions of a few owners. So I'm glad to hear that the service has been so widely utilized. 153 is a really impressive number. I didn't think it'd be that high. And that
it's actually 160. I got nothing while we've been on the call. It's over 160 now.
Excellent. Okay. So that'll be really good news for a lot of not just restaurant owners, but the staff that rely on those jobs and the patrons. And it would indicate that restaurant owners and managers and the employees are really rising to the challenge and the privilege that comes with it of avoiding actions that put diners and staff at risk. So, I mean, I think we have high expectations for our residents, and it seems like they're rising to the challenge. So I'm glad you all went in this direction, and I'm glad people seem to be taking it very seriously. And thanks for working with the theaters and the hospitality group. I know they've been waiting a long time on the recommendations, and they're hanging on by a thread, many of them, and I'm grateful for your attention to that issue as well. And finally, kudos for going on WAML. Their hosts and their listeners, like everyone in the region, really need to hear voices like yours. And I know some people might think it's a hostile environment, but I personally try to go on there every time I'm asked. The whole nation and our whole civic discourse really suffers from confirmation bias. This has been very well documented. We all tend to talk to those we agree with disproportionately and listen to those we agree with disproportionately. And it might be comforting psychologically, but it's not a recipe for widely adopted and thoughtful public policy. So I'm really glad you're there. And I'm really glad their listeners are hearing from you. This is tough and it's complicated stuff. I think everybody needs to hear your data-driven decision-making and your level-headed guidance firsthand, particularly their listeners, like everyone in the region. So kudos again for reaching out to them and not just some others that cover the council a little more than that station might. Thank you.
Thank you. And the last council member that's going to speak this afternoon is Councilmember Glass, and we are right at 11:29. So Dr. Gales, we're almost there. Councilmember Glass.
I'll make this quick. I want to associate myself with all the comments of my colleagues and really succinctly, thank you, Dr. Gales and Dr. Stoddard, for working so hard to keep our residents safe and for also trying to keep our guests safe. But, we know, as was evident over the last number of days, some guests seem to ignore federal and local guidelines and best policies and protocols. And one guest in particular, the COVID in chief, continues to make a mockery of this deadly virus and putting his staff and everybody he interacts with at risk. But thankfully here in Montgomery County, we are home to Walter Reed. We are home to the National Institutes of Health, and we're home to the Food and Drug Administration, whose staff are working day in and day out to keep our county, our country, and the world safe. And we're also home to Novavax, which is leading the global pharmaceutical efforts to produce a vaccine, all things that we are proud of and should be proud of. And the predicament that we're in is because of the presidents, right? Let's just be honest about that. And as we look around the world and see how other nations and other areas are handling this pandemic, we know that they're doing better than we are. And that's not up for debate. And no doctor can spin it. And other world leaders are making tough decisions while our top decision maker in the United States is abdicating that responsibility, which is why this conversation is so important. And which is why I so appreciate the leadership that the two of you, Dr. Gales and Dr. Stoddard, are putting forth to guide us, to educate us, and to help create policies that balance all the interests in our community. And I know it's not easy, but I just want to say thank you. And hopefully come January 20th, we'll have new leadership in the White House that we can count on to be true partners in our efforts to protect our residents and keep everybody safe. So thank you very much, and I yield back.
Thank you very much. Thank you very much to Dr. Stoddard and Dr. Gales. Thank you for being with us. Go ahead.
I want to make one more comment in support of what Councilmember Glass and actually Councilmember Friedson, NIH, National Cancer Institute, FDA, all housed in Montgomery County, NIST. 4 of the 8 largest grantees of the Operation Warp Speed are either housed in Montgomery County or have offices here. Montgomery County is going to be a big part of the solution to this pandemic before it's over with. I think that's really important for us to understand. And so, you know, when we see when we talk about our residents, like this is when we talk about we don't have the same national effort I think we'd like to, but we need to have a Montgomery County community effort around keeping our community safe so the people who are working at these vaccine development locations, who are working at FDA or working at NIH to try and find a solution are able to do that job. We can keep our infrastructure operating safely. That is all part of our consideration overall, is that we're part of an effort that's bigger than ourselves. And we're going to be part of the leadership that gets us through this. So I think it's really important that we continue to remember that.
Again, thank you. And thank you, Dr. Gales and Dr. Stoddard, for being with us.